Hey guys, good morning. How's everybody doing this morning? I'm gonna pull this live video up on my phone too, so I can see the comments or if questions come through. And then we'll get started in just a minute or two. Wait for a few other people to jump on here. Might be running a little bit late. Just a second. Just a second, guys. Hold on. I know. Yeah. All right, sorry about that. Good morning, Zoe. How are you this morning? Okay, guys, we'll go ahead and we'll get started here. So if you guys are here to learn a bit more about running pain-free, you are in the right spot. We're going to be going over the best warm-up prior to running, and then also go over some other common injuries that we see with in runners, and discuss kind of some treatment options with that, and give you guys some self-assessments to figure out, what exactly is going on. So let me pull up the slideshow here. If you guys can hear me, all right, go ahead and put in comments whether you can or not. And then this is gonna be like super informal. If there's any questions that come up throughout this workshop, just put them in the comments, and I'm happy to answer those as we go along too. Good morning, Kelly. All right. So for those that don't know me, my name is Dr. Ben. I'm a physical therapist with Pro+Kinetix Physical Therapy and Performance practice within Truve. We specialize in helping people that are active adults or athletes that are trying to get back to working out and doing it pain-free, and realizing, just because as we get older and stuff, a lot of times people will use that as an excuse that, oh, it's just part of aging. It's normal to have pain. Well, that's not necessarily true. I know a lot of people that are 75 and able to exercise pain-free, and I know a bunch of 20-year-olds that have shoulder pain, knee pain, low back pain, way more pain than these 70 or 80-year-olds. So age is not always correlated with pain or injury. Okay. And just some quick facts about running. So up to about 70% of recreational and competitive runners usually sustain overuse injury, sustain an overuse injury during any 12-month period. 42% of all running injuries are to the knee, and then followed up by 17% to the foot and ankle, and then 13% to the lower leg, usually like with the shin splints, and then about 11% with the hip and pelvis. And why are running injuries so prevalent? And it's because when we run, we are landing with 3 to 5 times our body weight, right? And a lot of times when no knock on runners, but a lot of times when people that are really dedicated to running, they don't do any strength training. They just run. And what happens is when your body's having to support 3 to 5 times your body weight with every step, and especially if you're putting on high mileage, your body's eventually going to break down if you don't have that strength. So we're going to talk about how important strength training is today as well, and some exercises that are going to help out with that as well. Okay. So let's go over like some predictions or predictors of injury. So history of injury, all right, is the biggest one. Okay. So if you've had injury in the past, most likely you're going to sustain another one again if you didn't treat that root cause or figure out what was going on with that. And then weekly mileage, and then also just looking at the movement patterns of the lower body, and how does your knee move when you land with running. How does your ankle respond to those impact forces? And another thing is body mass index. All right, like I said, we land 3 to 5 times your body weight. So if we're able to lose 5 pounds, right, that decreases how much compression we're landing with, right? 5 pounds lost, if we're doing we times that by 3 to 5, we're looking at between 15 to 25 pounds of less impact just from losing 5 pounds. So it can make a big difference with regards to that. Okay. So we're going to talk about like most common types of injuries that we see with runners and kind of describe those as well. Hopefully that all so far everything makes sense and whatnot. And again, just go in the comments if something doesn't quite make sense. All right. All right. So number one thing is patellar tendonitis. Okay. Patellar tendonitis is inflammation within the patellar tendon. Okay, so the patellar tendon is, let me go ahead and I'm going to switch my screen here so you guys can see a little bit better. Just a second here. Okay, so the patellar tendon is right here on the front of the knee. Okay, right here. And so a lot of times if people have pain here, it's likely due to patellar tendonitis, right? So this is a tendon, and when it gets overworked and inflamed, we can start having some pain in that area. And a lot of times this is due to different type musculature or weakness of the hips, stuff like that. And so one thing that can help a lot with that is just loosening up the quadricep muscle. And the reason for that, give you guys a little bit of a brief anatomy here. So we have our quad muscle, okay? Our quad muscle is on the top or front part of our thigh. And then it comes down and it attaches at this kneecap, okay? Our kneecap's right here. When I'm standing, okay, with my legs straight, my kneecap is here, okay? Now watch what happens as I bend my knee. You guys see how this drops down? Now my kneecap is down here, okay? Okay, it's up here. Now when I bend, now it's tracking, it's down lower, okay? For our kneecap to be able to do that, we have to have adequate quad motion, or we can't have the quads too tight. Otherwise, it's not going to allow that kneecap to drop down. If that kneecap doesn't drop down, then we start seeing it sit a little bit higher, and it's not traveling in the groove that it's supposed to. Okay, and the compression underneath that kneecap and the knee joint is increased, and we cause friction, rubbing, and we can cause some inflammation and stuff underneath that kneecap. Okay, and that can impact the stresses placed on that patellar tendon. Okay, leading to that inflammation and that pain as well. Okay. Another one that we see a lot is with shin splints. Okay, and so shin splints are, and this can be more of like with regards to somebody's running form. Okay, so there's two different ways that that people run, and that's with the heel strike, or if they run more on their forefoot. What I mean by that is when we go and run, if we're landing with our heel first, okay, we're just landing right on a bone. Okay, we don't get any shock absorption through the muscles. Okay, so through the heel, then the next thing that it hits or it has to absorb the shock is our shin. Okay, and then it works its way up to the knee, and then hip and low back. Okay, so if we land with our heel, we're not getting shock absorption. One way to decrease how much stress is going through that heel is switching to more of a forefoot run, where we're landing more on the ball of our foot, not like on our tiptoe through home. We don't want to be running like this, but just running more with where we're landing on our forefoot with just about a half inch off with our heel off the ground. Okay, so by doing this, now we switch the stress to the calf muscle. Okay, now we're getting some muscle activation to help absorb that shock, rather than just going straight from bone to another bone, right? And having to, because bone are not supposed to be absorbing tons of force, okay, especially not 3 to 5 times our body weight. So a lot of times if we switch to a forefoot run, we decrease a lot of that stress on that shin bone. So for example, I had somebody that came in and saw me today. She was getting ready to run a marathon, and it was 3 or 4 weeks before her marathon, and she was having terrible shin splints. This was going on for about 2 to 3 weeks. And so 3 to 4 weeks is not a whole lot of time to get somebody ready for a marathon when they have quite a bit of inflammation going on. So the only thing that could really give her a shot of being able to run this marathon was switching how she ran. Okay, so she was striking a lot with her heel first. We changed her running, so she was running more on her forefoot. And props to her for being able to be so adaptable to that, because it's not easy especially because she had been running for years and years and years. She had been dealing with on and off shin splints and some other injuries and whatnot. So it's not easy to switch your running form to heel strike when you've been doing that for years and years and years to switching to forefoot. So props for her to be able to switch. But because she was able to switch, we were able to decrease how much inflammation was going on in that shin. And we were able to allow her to still continue to run, because when she started going to the forefoot, she wasn't having nearly as much pain. Okay, so it told me that things were starting to calm down and that shin was responding pretty well. Okay, so and she was able to run a marathon. She was able to complete it, and she did have a little bit of shin pain, but she said she was like 90%. Just after those 3 or 4 weeks, and she was able to continue with her normal mileage too. So that's how big of a difference switching running form can be. And so hopefully that kind of makes sense, and the changes there, and how important it is to do a forefoot strike. However, you want to be careful. You don't want to ramp that up too quickly, because that leads me into our next thing that we see a lot is Achilles tendonitis. Okay, so that's tendonitis of the Achilles. So that is this right back here. Okay, if somebody has pain in the back, kind of above their heel, that's more of Achilles tendonitis. Okay, and the Achilles is something that gets a lot of force transmitted through it when we do switch to that forefoot. We have to make sure our calves and our Achilles build up some tolerance with that, and so we don't want to just jump too much into that forefoot running right away. Okay, if we don't have to. Okay, if somebody's got like a race that's coming up, then we can, be a little bit not as conservative about it and whatnot too. But in general, if you got time, we want to slowly ramp that up. Okay. Where we have pain on the outside of our knee. Okay, so like right here. Okay, so we have our IT band that spans from our hip. Okay, it starts from here, and then it goes down and attaches at the side of the knee here. Okay, a lot of times people will have pain right where that inserts. Okay, and that's because that IT band gets irritated or tight after running. Okay, so I hear a lot of people like, oh, after I foam roll my IT band and stretch my IT band, it feels better, but then 2 or 3 days later, it's back after I run again. Okay, so the thing with mobility and like foam rolling and stretching is it's great, but you're really just treating the symptoms. You got to find what the root cause of it is. Okay? And the root cause of IT band issues is actually due to weaker muscles, especially up the chain, such as in the glute muscle. Okay, so if we have a muscle, it's called the glute medius. Okay, so it attaches, it's kind of like right here. Okay, right on the side of the hip, and it's responsible for kicking the leg out. Or if we're squatting, it's responsible for not letting the knees collapse in. Or if we're running, it's responsible for not letting that knee collapse in like this as we run. Okay, next time you guys go out running, I want you guys to watch people run. Okay, I do this on my runs. It's good entertainment. So watching their knee angle as they run. When they land, is their knee collapsing in, or is it staying out here where it should be? Okay, if their knee is collapsing in like this, it's mainly because they have hip weakness. Right. So like we talked about, the orientation of the attachment of that IT band is from here to here. So every time that knee collapses in, guess what structure is getting stretched and elongated and irritated? It's that IT band. Okay. And so if we just foam roll and we just stretch, that doesn't change the fact that our knee is collapsing in every time when we go on a run or anything like that. So if we treat the root issue and start strengthening that glute medius muscle like we're supposed to, then we don't see that knee collapse in so much. Okay, so that's super important. Next thing, so that's the main injuries we see. There's a few other ones like plantar fasciitis and whatnot, but those are the main injuries that we see. hopefully that makes sense, guys. If you have any questions about those injuries, just let me know. All right. So let's get kind of into treatment and kind of what our thought process is as a physical therapist when somebody comes in with running injuries. So we need to find and understand the cause, right? Is it the way they're running? Is it weaknesses or imbalances, or is it, is it their nutrition? Are they, not getting enough water intake? There's so many different. It's a multifaceted issue. Okay, so we need to find and understand the cause of it, because we can do all the treatment we want, but if we keep going back to what's irritating or causing this issue, it's an uphill battle. Okay, so next thing is we need to control swelling. We need to let that swelling decrease. Usually give 5 to 7 days of rest just to kind of reset everything, and then we need to start restoring range of motion. Are the quads tight? Are the IT bands tight? We need to start stretching and loosening those up to get the stress relief, the pain relief. And then also we need to, lastly, it's kind of like phase 2, is strengthening and getting to the root issue of it. And then phase 3 is making sure this doesn't happen again, right? And looking up the chain, make sure everything else is working properly throughout the body. All right, and then another thing is like weight loss. If somebody's a little bit overweight, this can be impacting things too, because we talked about how body mass index impacts and can increase the risk for injuries because we're landing with 3 to 5 times our body weight. And then also activity modification, getting in a variety of exercises or activities where we're not just always doing running. We're doing biking, we're swimming, we're doing strength training, stuff like that. We need to do other activities outside of just running. Okay, we need to strengthen up the body. And so strength training with runners, I can say confidently that runners should be strength training at least 2 to 3 times a week. Okay, and doing full body movements, squats, deadlifts, lunges, single leg exercises, stuff like that. Okay, and then also knee braces. Okay, what does the evidence say about this? So what the evidence says about this is that we need to we shouldn't necessarily need to be relying on knee braces. Okay, the knee braces, what they do is, and any brace in general, what it does is it helps provide support for that knee, where we should just be getting that support from other muscles, okay, such as our glutes, our quads, our hamstrings, stuff like that. We should be getting support from those and not rely on knee braces. Okay, knee brace can be useful or beneficial if we're having a lot of pain and we need some support to help decrease that inflammation, but we need to start weaning you off the brace as soon as possible. All right, and then lastly, if those things don't help, then you need to seek out like a medical professional, whether it's a physician, physical therapist, somebody like that understands what you're trying to get back to. Okay, so that's kind of the treatment in a nutshell. It's a little bit more complicated than that, but that's a good place to get you guys started. One thing I wanted to do today was give you guys a good warm up that you can do for people that want to run and not have pain, and make sure that they're effectively warmed up. So we're gonna go ahead into that. Again, do you guys have any questions about any of it or any of the pathologies or anything that we talked about so far? Okay, awesome. Not seeing any. All right. Before we get into the warm-up, actually, let's go over just a few other general tips. Okay. So we need to make sure that we're also progressing appropriately into exercise. This is where I see a lot of people get injuries, and it's because they accelerate and increase their mileage too quickly. This has been super common as of late with the shelter in place and everything, because now the people that used to go to the gym aren't able to, and some are switching to at-home workouts, but a lot of people are starting to run more than they used to, especially because people get quite a bit of stress relief from running too. So I've had a lot of people reach out with regards to having more pain with running and whatnot, especially if they're just starting up. And so we want to make sure we give our body ample time to adapt to the impact of running, landing with 3 to 5 times our body weight. It'll take about 12 weeks, depending on the personal training history of when your body is able to adapt. So next thing would be, run slower than you think you should. Okay, you can obtain a lot of the health benefits of running with a very slow pace. You should be able to say a complete sentence without breathing in between. A slower pace will, decrease the impact per step. It will also allow for a smoother transition to adapting to that impact as you progress over 12 weeks. Make sure to slowly pick up. That's when you can start picking up the speed, but you need to start slow with that too. Okay, so that's another quick tip. And then number 3, I don't want to sound like I'm being a dead horse here, but it's the one thing that's super important is strength training. Okay, we need to be doing strength training. Okay, specifically the lower body. Okay, doing single leg exercises such as lunges, single leg deadlifts, stuff like that. And so we're going to go over some other single leg exercises that you guys can do for that. And then also doing squats and deadlifts aren't bad too, even though those are double leg. It's helping to train those glutes, those hamstrings, those quads, those muscles that are important for that. Okay. Next thing would be our cadence, our run cadence. So take short, fast steps. This will decrease the amount you bounce up and down, decreasing over striding or landing. What I mean by that, by overstriding, is where we are we're landing with our foot too far out in front of us. And what that does is it increases the braking force, okay? And we're much more likely to land on our heel the longer our stride gets. And the longer our stride gets, we get more impact through the legs, okay? And landing with more force. So most experts recommend a cadence between 170 to 180 steps per minute. There's also music playlists on Spotify that can help you stay with this cadence as well. So that's super important. And then the last one is limit pain. If you do have pain with running, it doesn't necessarily mean you should stop. But limiting pain to like a 4 out of 10 or a dull ache is unlikely to result in further tissue damage. In addition, like this rule, you should not have an elevated level of pain as you go along or for more than 24 hours after running. If you do, the stress was too much for your body, and you should run slower and for less time on the next run. Okay, so make sure you're in tune with your body after you get done running and monitor the level of pain that you're having as well. Okay, and if pain persists for more than a couple of weeks, see a professional. Okay, if it's been around longer than that, it's not something that's going away. Okay, it needs to be need to have an individual assessment done to figure out what the root cause of this is. Okay, so hopefully that all makes sense. Those are my 5 big tips for that. And then I'll be also, so these tips came from the ebook that I wrote on running, or the pain-free running guide. So for you guys that attended, I'm happy to send that over to you guys. If you just want to give me your email address after this, Kelly and Zoe, I know I have Kelly's. Zoe, I'm not sure if I have yours, but I'll send that to you guys after this. And you guys can take a look and whatnot too, to review those tips. There's a couple other things in there too. So I'm happy to send that over. But yeah, any questions on any of that, guys? Otherwise, we're going to get into some good warm-ups for prior to running. Let me go and pull those up. Okay, so again, if you guys have questions, type that in. I'm going to go grab the equipment we need for this. For you guys that are watching, you could grab like a small loop band, okay, elastic band, and we're going to need that. I'm going to go grab mine. Okay, guys, so we talked about the importance of the glute medius muscle, okay? And because like I said, I think it was 43% was the amount of percentage of people that have knee pain with running. And a lot of times it's a result of that weak glute, okay? So we are gonna focus on warming that up and then also warming the feet up correctly. We talked about Achilles tendonitis, plantar fasciitis, IT band issues, patellar tendonitis, patellar tracking issues, stuff like that. So that's what we're going to gear towards these warm-ups for, okay? So what I want you guys to do is go ahead and grab You can grab a band, a loop band like this or like this. Okay, either one. All right, I prefer this one myself. All right, so what you're gonna do is you're gonna loop that around your feet. Okay, and then we're gonna loop this and bring it around the top of our knees. Okay, so what we're gonna do from here, let me get this chair out of the way before I hurt myself. All right, and what we're gonna do is we're gonna get into kind of a squat position, like a quarter squat position. Okay, and then what we're gonna do from there is we're gonna try and pretend like we're trying to separate the floor with our feet. Okay, I'm representing my hands of what I'm trying to get my feet to do. Okay, what I'm doing is I'm turning out and coming back in. Okay, we don't want to be moved. We don't want our feet to be turning. I'm gonna back up here a little bit so you guys can see my feet too. Okay, so what I'm doing here, again, is just trying to separate the floor with my feet. And in doing so, I am actually moving my knees out. Okay, don't let the toes come up or feet round out like this. Okay, we want to make sure we keep our big toe pushed down. Okay, and then we're just doing 15 repetitions here. Okay, make sure when we pull out, we're holding and pausing and then slowly coming back in. Then quickly going out, slowly coming back in. Okay, and we're going to do about 10 repetitions of this. And you should feel this kind of in the glutes on the side of the hips. And this, again, this is just a warm up. We don't want to be fatiguing these muscles out too much. Okay, we just want to do one set of 15 of this. Okay, to strengthen, we'd ideally want to be doing 3 to 15. Okay, so on days you're not running and you want to strengthen up things, do 3 sets of 15. But before you run, all you want to be doing is 1 set. Okay, we don't want to be fatiguing these muscles out too much. Okay, next one is called the fire hydrant. Okay, all right. So what we're going to do is this is great for warming up the hips as well as warming up the feet. So like I said, when we're running, we're never on 2 feet at one time. Okay, we're always on one leg. Whether it's left versus right, we're always on one. Okay, so we want to do exercises that are going to replicate that. So what you're going to do is you're going to go into a single leg stance, bend the knee slightly. Okay, and then what we're doing from there is we're kicking out and coming back in, out and in. What we don't want is, as I bring this knee out, we don't want to see this knee collapse in. We want to make sure we're fighting that. Okay, keep that knee out. Okay, and fighting that. Okay, again, try not to let your foot come up. We want to keep all our toes in contact with the floor. Okay, evenly distributed throughout the feet. Okay, and then out again, back in. And again, we're pausing when we get out here and slowly coming back in. Out and back in. Out, back in. Okay, so you're gonna feel this on both glutes. Okay, the one that's moving as well as the one that with the leg that you're standing on, because that leg that you're standing on has to stabilize the pelvis from not dropping down. Okay, so you're gonna feel them both. That's normal. Okay, again, same thing other side. And you might notice some imbalances between left and right, such as might be easier to balance on one side versus the other. You may also feel some fatigue in your feet too, and because your foot and your ankle has to work quite a bit to stabilize. Do 3 more. Good, and relax. Okay, so those are 2 good ones. We're gonna go over 1 more. All right, and again, this is for the hip. So you can do is you can get in a half kneeling, or sorry, a half quarter or a quarter squat position like that, like this, and then we're just sidestepping. Okay, and back. Yeah, ideally doing about 15 steps each direction. Okay, should feel this quite a bit in the hips too. All right, so like I said, we don't want to be over fatiguing the muscles. Okay, so I just choose 2 to 3 of those exercises and do 1 set of 15. Okay, and again, these aren't just like some made up exercises that I chose. All right, everything that we do, that's another thing that's a little bit different. What my practice is, everything we do is based on research and what the best research says. on what we should be doing, okay? And research article after research article continue to list those three as the best for runners, okay? So that's based on research. Okay, let's see, I see a comment here. Sometimes you do that fire hydrant exercise on the ground on all fours. For running warm-up, is it best to do standing and balancing? Great question. So Zoe, yeah, so it's fine to do it on the all fours. However, you got to think about also when we are all like on the all four position, we're not having to stabilize on one leg, right? And our feet don't have to work to stabilize or support ourselves. Okay, so I'm biased, but I can confidently say that if you do it on the fire hydrants on one leg, that's gonna be better than on all fours. Okay, but for generalized strengthening, it's a good way to get some variety into if you want to do on all fours versus on a single leg position. Okay, but big thing is the feet are super important to make sure we're warming up and utilizing as well. And we just don't get that in the all four position. Okay, but good question. Hopefully that makes sense and whatnot too. And yeah, it's also going to help with your balance, okay, and your stability. And it's going to decrease your risk for ankle sprains too. Okay, that's another good exercise that I give to a lot of patients that have came in with an ankle sprain. Okay, to get those muscles to wake up again. Okay. All right. So, any final questions, guys? We've covered tons of information today. Hopefully, I didn't overwhelm you guys too much. Okay. But yeah, main thing is strength training, super important. Number two, make sure you're ramping up appropriately and listening to your body. Again, last third tip, that's super important, would be listening with regards to pain and making sure we don't get above a 4 out of 10 pain and listening to our body 24 hours after we're done running, okay? Like I said, I'm happy to send over those exercises as well as the ebook or the pain-free running guide to you guys as well. But yeah, hope you guys found it beneficial. Give those a try. And again, if these things start continuing to linger on, or you're having pain with it after 2 to 3 weeks of trying some of these things, it just means your body needs something that's tailored to you. Again, these are all just a very generalized. I haven't done assessments on anybody. We need to make sure we get to the root cause of it and correct it. Okay. All right. But I hope you guys enjoy the rest of your day and continue to have a good week and enjoy the nice weather and try and get out. Make sure to get some vitamin D in a responsible way. Okay, and get out and run and get that stress relief. Right. But if you guys have if anybody's watching this on replay and you have questions, make sure if you can go ahead in the comments and ask questions. Just make sure you tag my name in it so I get a notification that you have a question. Feel free to private message me as well. I'm here to help. Okay. All right. And then if you guys want more individualized attention or guidance, I'm happy to hop on a phone call with you and see if we can start giving you some tips right away to help you guys out and figure out what's going on. All right. But yeah, hope you guys enjoy the rest of your day, and then I will see you guys next week. All right. Bye.